Have you ever heard of a condition in pregnancy that can be completely silent but suddenly turns life-threatening? That is preeclampsia. Preeclampsia is one of the leading causes of maternal and perinatal mortality worldwide. Many women feel completely fine, no pain, no warning signs, and yet their blood pressure is dangerously high. In today's video, we're going to break this down in a very simple way. What is preeclampsia? Why is it dangerous? The warning signs you should never ignore, who is at risk, and most importantly, what you can do to stay safe. If you're pregnant, planning pregnancy, or you know someone who is, this is a video you need to watch to the end. Welcome to the Obstetrician's View. I am Dr. Elizabeth Nonobari Obidino. I'm a consultant obstetrician and gynecologist, and in this channel, I share conditions related to women's health in simple and understandable way. You may want to subscribe if you have not. So what is preeclampsia? Preeclampsia is a condition that occurs in pregnancy only, usually after 20 weeks of pregnancy. It is defined as high blood pressure and signs that organs are being affected, especially the kidneys, the liver, and other vital organs. The classic signs doctors look for is protein in urine. But preeclampsia is much more than just high blood pressure. It is a condition that affects the brain, the kidneys, the placenta. So think of it this way. The blood vessels become irritated and narrow. This reduces the blood flow to important organs, including the baby. So why is this dangerous? Preeclampsia can become severe very quickly. If not properly managed, it can lead to eclampsia. This is when a pregnant woman starts having seizures. This is a medical emergency. Another thing is stroke. Very high blood pressure can cause bleeding in the brain. There could also be organ failure. The liver and kidneys can begin to fail. There could be placenta problems. The placenta may not function properly, leading to poor growth of the baby, premature delivery, stillbirth. Another thing that can occur is death. Yes, in severe cases, preeclampsia can be fatal. This is why antenatal care is not optional, it is essential. So who is at risk? Some women are more likely to develop preeclampsia than others. Some of the risk factors include a woman who is carrying her very first pregnancy, a woman who had her last baby more than 10 years before her current pregnancy, a woman who changed her spouse or has hypertension prior to pregnancy, diabetes, or has had a previous history of preeclampsia, a woman carrying multiple pregnancy, twins, triplets, a woman who has kidney disease, obesity, or a woman whose age is greater than 35 years. But here is the important part. Even women with no risk factors can still develop preeclampsia. That is why every pregnant woman must be monitored. So what are the warning signs? This is where many people get it wrong. Preeclampsia can actually be silent, but when warning signs do occur, they should be taken seriously. So watch out for persistent headache, blurred vision, or flashes of light, seeing flashes of lights, swelling of the face and hands, sometimes of the entire body, severe upper abdominal pain, reduced urine output, nausea and vomiting, especially occurring in the later part of pregnancy, sudden weight gain. All of these could be pointers to something sinister. So if you notice any of these symptoms, do not wait. Go to the hospital immediately. So how is it diagnosed? Diagnosis is usually straightforward during antenatal visits. Blood pressure measurements, urine test for protein. This is why regular antenatal visits are so important and cannot be overemphasized. You may feel fine, but your blood pressure may tell a different story. So how is preeclampsia managed? The only definite cure for preeclampsia is delivery of the baby. However, management depends on how severe it is, how far along the pregnancy has gone, and treatments may include blood pressure, medications, anticonvulsants, and close monitoring of the mother and the baby. Sometimes, doctors may need to deliver the baby early to save the mother's life. If this happens, do not resist. That may be the best decision. So how can you reduce your risk? While preeclampsia cannot always be prevented, you can reduce your risk by attending antenatal care regularly. This is important because during antenatal care, your blood pressure will always be checked, urine tests will be done. This can help to detect this condition very early. Also, taking prescribed medications like low-dose aspirin, if recommended for you, is very important in preventing this condition. Maintaining a healthy weight during pregnancy, managing coexisting conditions like hypertension or diabetes is important to preventing this condition. Do not self-medicate. Always follow your doctor's advice. Even if you have been pregnant before and you were given certain medications, it doesn't mean they may be important in this pregnancy. So don't self-medicate. Don't manage yourself. Don't treat yourself. Always consult your doctor. Always follow your doctor's advice. So we have looked at preeclampsia, what it is. We have emphasized the fact that preeclampsia is a very severe condition in pregnancy that should not be taken lightly. It is one of the major causes of maternal and perinatal mortality. In fact, in the hospital where I practice, it has been the leading cause of maternal death for over 10 years now. And these figures are even more in women who do not register for antenatal care but are seen just at the point where complications have set in and the chances of their survival is drastically reduced. So preeclampsia is not a condition to be taken lightly. We have looked at the warning signs. We also said that preeclampsia can be silent. Some women just go about their business, yet their blood pressure are very dangerously high. But when warning signs do occur, please do not take them lightly. Go to the hospital immediately. We looked at how preeclampsia can be diagnosed. We also talked about some things that can be done in the management of preeclampsia, and also looked at some things you can do to reduce your risk of preeclampsia, even though some women may have no risk factor and yet come down with preeclampsia. So know that preeclampsia is dangerous, but it's also detectable and manageable when caught early. Do not skip your antenatal visits. Do not ignore symptoms. Your life and your baby's life depends on the decisions that you make. If you found this video helpful, share it with someone who is pregnant or planning pregnancy. And do not forget to subscribe to the Obstetrician's View for more simple, life-saving medical information. Also remember to drop a comment in the comment section. What will you like me to discuss next? What condition in pregnancy do you find really confusing? And have you ever seen a woman who had preeclampsia or eclampsia in pregnancy? I'll see you in the next video.